foam rolling and stretching for shin splints. So we're going to be foam rolling for the most common form of shin splint, which is the medial or the posterior shin splint. So in that situation, it's usually the soleus, or this really thick, tight muscle that lives right underneath the Achilles tendon and connects in underneath the gastroc, which is that big belly of the calf. So we'll start with a regular foam roller, which is the most common way that you would probably roll out your shins or your calves. And we're going to place that foam roller just a couple fingers above the ankle, and you want to turn your toes in. So that way we're focusing a lot more on that inner or medial side of the calf or the soleus. You can experiment with flexing your foot or pointing your toes, whatever feels the best for you and the most effective. But what you'll do is you'll push into your other foot and raise your hips up just a little bit, and we're rolling in that sawing motion along that inner part of the calf, focusing especially on the lower area where it's going to be tighter. If you feel anything that's particularly tender, you want to hang out there for about 30 seconds or so until you feel it release. Now, if this is not tough enough for you, you can use a yoga block and a lacrosse ball or a tennis ball, whatever you have available to you. And then similar principle, we're going to take the ball and we're going to place it in that same area of the soleus. So you want it's best to keep your foot flexed, at least when you're looking for the tightness. And then you don't need to pick your body up in this situation. You're just going to move your leg from side forward and back just by bending your knee like that. Now, if you feel something and it's really tender, you want to hang out on it. And you can even practice like moving your foot up and down, side to side. Like, so let's say if you pointed your toes, you might feel that like light up a little bit more. So, so you want to focus on that for a little bit longer until you start to feel it release. Now, if both of these options are just like the very worst, and let's say your shins are super tender, or maybe you just have a hard time holding yourself up with your arms, you can use a stick. Mine's pointy, but it actually feels really nice. You could even use a rolling pin from your kitchen. And you'd want to start with your foot planted and then pull your knee out to the side a little bit and then roll in that area along, kind of like along your shin bone in that fleshy part of your lower leg. Okay, now we're ready to stretch. So we want to loosen up the soleus and the gastroc to get your leg feeling happy again. So I'm using a yoga block, but you can use a staircase or a little stepper, whatever you have available to you. And you're going to take your foot and you want to place it so that the ball of your foot is just about an inch past the edge of the block. And you bring your other foot next close to it, and you're going to just apply pressure from your hip, leaning over your toes, and you want to keep that knee soft, so you don't want to lock that out. You're going to hold this for about 30 seconds, or until you feel your calf getting a little bit looser, and then we're going to sit into that hip and bend that knee down a little bit. And what that's going to do is it's going to give you even greater stretching throughout that lower leg. And we're going to hold that for about 30 seconds. We'll do both sides 2 times, just for maximum benefit. And then we're going to get down into a half kneeling position. We're going to do some dynamic stretching for the lower leg. So you can use a foam roller to help you balance in this position. And you want to use that on the same side of the leg that you're working on. So we're going to plant the heel and the big toe. And then I take my, let's say I'm working on my right foot, I'm going to take my left hand and guide the inner part of my knee so it doesn't cave in, because a lot of times people with a tight soleus, it's going to pull your knee in and it's going to feel pretty terrible, and it's actually not going to be a very effective stretch for you. So you want to use your hand to keep that kneecap lined up with your second toe, and we're just going to lean forward, bringing that knee as far over the toes as you possibly can while still keeping your heel down on the floor. We're going to just hold that for half a second, and then we're going to relax and come back into your starting position. Okay, and then again, push forward as far as you can, get that deep stretch, and then relax it back again. You're going to do this about 15 to 20 times on each side. And the final stretch that you want to do is actually to loosen out your tibialis anterior, which is a big muscle right here over your shin. So what you'll do is you're going to take and come onto your knees and extend your feet out onto the floor. And then you're just going to sit back on your heels, and you can try to reach your arms back any amount to stretch out this area. If you have tender knees and this is painful for you, you can take a towel and bring that into the crease of your knee, and then try sitting back. It's really not very important how far back you can get your heels to your hips, or your hips to your heels. It's more important to just focus on stretching this area through here. So the best way to do that is by applying pressure backwards. And that is foam rolling and stretching for shin splints.